Men in Nursing is our episode topic. My guest is Dr. Ernest Grant, Vice Dean for Diversity, Equity, Inclusion, and Belonging at the Duke University School of Nursing and the 36th President of the American Nurses Association. So let's get started.
Welcome to the BRG Nurse Executive Podcast. BRG is a global consulting firm that helps organizations in disputes and investigations, corporate finance, and performance improvement and advisory. BRG's healthcare performance improvement practice offers multidisciplinary services to healthcare organizations. We focus on implementation with innovative, independent, and data-driven solutions. In the BRG Nurse Executive Podcast, we discuss improving patient care by advancing nursing leadership. For more information about BRG, please visit thinkbrg.com. Now here's your host, Nick Chmielewski.
Ernest, thank you so much for joining us today.
Thank you very much for having me.
Before we get started with today's episode topic, can you share a little bit about yourself with our listeners?
I'm from the mountains of North Carolina, a little small place called Swannanoa. A lot of people maybe have heard of it recently because unfortunately it was totally destroyed by Hurricane Helene. But it was the kind of town where everybody knew everyone and watched after everyone's kids. So the old term, it takes a village, I can certainly identify with that. My mother worked at the post office and would tell people, I don't care what color your skin is. If you see my kids doing wrong, you have my permission to discipline them. In my case, I think it was worse than being a preacher's kid, but I am very appreciative of the guidance, I should say, that a lot of the folks there in the Swannanoa community provided for me. It made me the individual that I am today. And outside of choosing to go into the nursing profession, I think just having the guidance there and people wanting you to be successful, again, also helped me to become the individual that I am today as well. And that's pretty much it. Just a little hometown boy who, if you talk to the folks in the mountain, he went to the big city of Chapel Hill, and there he is.
Our topic today is men in nursing. And can you talk a little bit about how your experience, particularly as an African-American male nurse, has influenced your career and shaped your perspective on the nursing profession?
The best way to start answering that question is to think about when I was back in high school. If someone had told me, have you ever thought about nursing? I would have said, you're crazy. My dream at the time was to be an anesthesiologist and to drive a lime green 1968 Mercury Cougar. So I would suggest that your audience, if they haven't seen that car, Google it after they listen to the podcast and they'll see why I still think that car is the bomb. But my high school guidance counselor recognized that I was coming from a poor family and there were not scholarships available. It suggested that I go to nursing school, become a CRNA or nurse anesthetist. And then if I still wanted to go to medical school, I could work my way through med school as a CRNA and not have so many bills and loans to pay back. So I decided to do that. And about 3 months into the nursing program, totally realized that nursing was my calling and did not, look back at the possibility of going on to medical school. Part of that, though, also, as I became a nurse, I'd look around and I wouldn't see anyone who looked like me. That being a Black male, let alone a 6'6" Black male who was in the nursing profession. We're talking the mid-70s here. And men at that time probably made up about 3% of the nursing profession. It became quite challenging to again, try to find someone who could either serve as a mentor or who could provide some guidance for you. And of course, you knew that your every move was under the microscope. We're also, keep in mind, we're at the tail end of the civil rights era. Again, being a Black male in the South, how would that be perceived that you may be providing care to white women, actually? And so that too was quite a challenge. But I think overall, even as 40 some years later in my nursing career, as I look back, I think just having that experience, being a Black male and advocating for the profession, but also advocating for more men and ethnic minorities to come into the profession, that sort of redoubled my effort. And as I said, when I started out looking for someone who looked like me, I now realize it's my responsibility to be that person for young men and ethnic minorities who are going into the profession to serve as a mentor for them so that perhaps they don't have to search around like I did. And of course, we are seeing the numbers increase. Right now, men make up probably, depending on who you read, about 12% of the nursing profession. But African American men, of the 5 million or so nurses that are out there, we estimate African American registered nurses probably is about 1%. So that's maybe 1,700, maybe 2,000 at the most of the 5 million. So we still have a long ways to go.
Now, you're definitely a trailblazer in the nursing profession when it comes to both men and more specifically African men. I'm on the cusp of using the term living legend. First male and third African American president of the American Nurses Association, among many other accolades. What has your journey been like as a minority leader? Because you're not just a minority among the nurses, but you're a minority now leading in various different organizations. What's that been like?
When I was elected as the first male president of ANA, it didn't hit me, but took a little bit for it to sink in. But also, just to achieve that milestone, in a way, you could say it was the ultimate reward for a long journey of going towards that. But I do remember the very first ANA convention that I went to. I went up to Beverly Malone was president at the time, who was the second African American president of ANA. And I remember saying to her, "I want to be where you are." And her comment to me was, "And we will do everything we can to make sure that you are." And I realized that in order to be president, I had to go above and beyond, because I knew people would maybe think that, oh, is he really qualified, and et cetera. So I knew that meant having to get a doctorate. I knew that meant having to have leadership experience outside of the nursing world, but to also prove that, yes, if he can serve as president or chair of this organization or president of this organization or serve on this board, he has vast experience. And also just understanding what it means to be a leader. I was president during a very challenging time for the American Nurses Association. I was president during COVID. So to not only get my fellow nurse colleagues to understand how the vaccines work, advocate for them that they get the protective equipment that they needed, and let them know that we were doing a lot of work both in front of the cameras and behind the cameras to make sure that they were able to practice safely. Those are some very big, challenging times. And I want to say that I did that with the help of the staff at ANA. It wasn't just me. There's no I in team, if you will, but it was all of us working together to ensure that things were done. But I also realized too, being a Black male, first in this historic position, also was a challenge in that you were going to be under the microscope, and that every move that you did or every decision that you made was probably going to be critiqued or criticized and coming at from different angles. And I quickly learned how to combat that. A lot of times, if I would get wind that someone was questioning why I made this decision or that decision, one of the things that I would do is call that person up, not to call them on the carpet, but to say, perhaps you didn't have all the facts that I had, or that we as a team had to weigh. And so based on that, or having that conversation with them, it won them over, I guess you could say, to realize that, oh, this is a different style of leadership or a different style of government, if you will, that perhaps they did not anticipate. Sometimes it's easy to be a armchair quarterback when in actuality, unless you really have all the facts, it makes it a little bit difficult, and especially during a difficult time like what COVID was. I do know that sometimes we would get emails that would say, "I'm dropping my membership." And one of the things I asked staff to do was to give me at least every week, probably maybe 5 or 10 names of individuals who had sent in emails or comments. Didn't necessarily say that they were dropping their membership, but I would personally reach out to them and say, "This is Ernest Grant, president of the AMA, and I'm calling because of the email that you sent. I'm not trying to change your mind if it was something that said I'm going to drop my membership or whatever. But I do want you to understand, first of all, that you've been heard. Number two, here are some of the other facts that if I was able to share the facts, here are some of the other things that went into the decisions and things that we made. And about 90% of the time, 95% of the time, for the individuals who said that they were going to drop their membership after having that conversation, they maintained their membership. And in actuality, membership grew by some 20% during my presidency.
It's amazing what the personal touch or the personal connection can do. No one asked you to do that. What drew you to that? And do you know if it's been sustained? Because clearly it's been successful.
I don't think it's been sustained, but one of the things that drew me to that, again, that was a very difficult time. And the other thing that I did was I had about 60 nurses around the country that I spoke with on a weekly basis that I used as my sounding board, if you will. And these were nurses who were at the grassroots level. They were in acute care, they were in the community, they were all over. And I would have conversations with them. What are you seeing happening in your community? It gave me a pulse of what was going on across the country. And as a result of that, because I knew if something was happening in, say, Wichita, Kansas, or in Iowa City, Iowa, or whatever, that chances are we're going to see that on the national level as well. So that helped us to prepare either educational materials or some other supportive materials that would help that we could distribute across the country. It also helped me when I would go on Capitol Hill and talk with members of Congress and to say that, like, for instance, the distribution chain that supposedly was in place to distribute the personal protective equipment. It turns out that the masks, the gowns and gloves and things were not rotated on the basis that they were supposed to have had. So people would be getting N95 masks that when they stretched to put them over their face, the rubber band would snap. They had dry rotted because they were not rotating. Again, to let people in Congress know that things were not done right or that there was some counterfeit masks that were coming in. Again, exposing people who were at the bedside. They might as well have walked into a room not wearing a mask when you have masks that did not meet NIOSH standards. I found that having that little working group of nurses, and some of them that I still speak with to this very day, it really does help quite a lot to have a pulse of what's going on all across the country so that when you are talking to various senators and representatives and could say, according to a couple of nurses in your state, this is what's happening. It personalized that and helped to move either legislation or funding through that would enable to provide the personal protective equipment that those individuals needed at that time.
What are your thoughts on how we can further advocate for increased diversity, particularly as it relates to more men and more people of color joining the profession of nursing?
It all boils down to having the presence out there in the public. You see a lot of TV shows, and if they're especially medical TV shows, and if it is portraying a nurse, chances are it is a white, blonde-haired, blue-eyed female, which is about 80% of the nursing profession. But unless a minority or a male sees someone that looks like them, who perhaps is interested in the profession, then if they don't see that, then perhaps they may think this isn't for me. I know I currently, one of the nursing organizations that I belong to, we have actually adopted a third grade class here in Durham. And once a month, I try to go in. Some of them go in a little bit more, but I try to go in at least once a month to help those third graders with their reading, their math, and et cetera, so that when they are considering the possibility of a profession, they may think, hey, it was a nurse that taught me how to read or helped me to learn how to read or helped me understand math. The other thing is to walk into a classroom of third graders as tall as I am. Again, I realize how very imposing that I am, but if they think, wow, if this 6'6" guy could be a nurse, why can't I? So I think that's planting the seed there as well. But part of it too is I think the way nurses may be portrayed in the media and et cetera, we need to have a greater presence of males and ethnic minorities so that other people it should be reflective of the American population. That's always been one of my statements, if you will, that nursing should be reflective of the people that we care for. And as we see America becoming more and more of the browning of America, if you will, then that means that we should have more ethnic and minority and men within the profession as well.
What motivates you in this work? And what are you hoping to achieve? I know we want more men in nursing. We want more people of color in nursing. We want the nurses that are caring for patients to look like and be like the patient population that they are serving. But what goes beyond that in terms of your hope and your desire?
I'm blazing the trail to give people the opportunity to join a profession. To me, that is the best known profession to mankind. And think about, to go back to the tail end of your question, when I'm old and infirmed and laying in a hospital bed, yeah, it would be nice to look up and see someone who looks like me that is providing care. And studies have shown that usually there's more increased patient compliance when they do look up and see someone who looks like them, who can advocate on their behalf as well. And there's that trust factor, if you will, as well, or maybe it's an unimplied trust factor that may exist. But to me, the satisfaction for me is that I'm trying to make a difference. And it could be that difference is increasing the number of man and ethnic minorities within the profession so that healthcare itself can be delivered on a higher scale or a higher plane. And that as nurses, we advocate for our patients. And who better than someone who may be from that same either ethnicity or culture of the person lying there in bed that could possibly say, in our culture, this is how healthcare may be approached, or this is how we view health and illness and wellness and et cetera. It's a way to bridge the gap, if you will, among the members of the healthcare team, and also that they should be embracing the culture of the individual and also realize that the patient should have a say in their plan of care also. And in some cases, and I've seen this over my career, where a lot of patients who think, I'm at an academic medical center, I had 15 people walk into my room, all in white coats, and they're saying, yeah, this is what we're going to do, da, 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 da. And sometimes they may say, well, you're the ones who's very educated, and yeah, I understand what you're saying. But then it's that one nurse who will stick around and say, did you really understand what they just laid out for you? And chances are that person will say no. So then that nurse is going to say, guys, we need to come back in and we need to have a more gentler conversation with this person because they really don't understand. They're intimidated by all those white coats that are there. Half of them may be medical students or interns or residents or whatever, but we forget how imposing that can be for someone who was maybe it's their first hospitalization, first time that they're away from family. They're worried about family, who's going to pay the bills, this type of thing, who's taking care of their pets, things like that. It's important that, that little bit of personalization, if you will, of making sure that, yes, you do understand what the game plan is. You do have a voice or say so, and that you are in agreement with the game plan. That's what it all boils down to. And so I think by getting more nurses to be able to speak up and to advocate, that would be the ultimate goal of what I'm trying to achieve here.
You mentioned earlier that you were in nursing school in the 70s. I was in nursing school in the early 2000s, about 25 years ago. What do you think the lived experience of the male nurse, both as a student and as a professional, as a registered nurse, how has that evolved over time from the 70s to the turn of the century to today?
Oh, it's evolved tremendously. One of the best pieces of advice that I got was, as I said earlier, when I was looking around trying to find someone who looked like me, chances are if I did see someone who looked like me, it was someone they were not a nurse and they weren't even labeled as a nursing assistant. They were called an orderly. That was usually a male who probably had military connections, probably in the military would have been a medic. But once they got out, then the civilian world at that time did not have a position for a medic. So they were considered to be an orderly, and they did a lot of menial tasks that some of the nurses did not want to do. And one of the best pieces of advice that I got was from a older white female nurse who was a diploma grad from one of the hospital schools up in the mountains. And she said, let me give you a piece of advice. Don't let them use you as an orderly. And what she was saying, and I found it to be true, was that I quickly saw that a lot of my female colleagues would call me to help lift a patient into a chair. This is before we had lift equipment like we do today. Or could you put a Foley in this patient or whatever? And my quick response to that was, I don't mind doing that, but tell me, what would you do if I wasn't here today? How would you get this person in the chair? How would you put that Foley in that male patient? Or didn't we take the same courses? If I had to learn how to catheterize a female, I'm sure you could do the same for a male. So eventually, I guess you could say I won them over to my side by politely, in a nice, polite way, of trying to say, again, I don't mind, but sometimes they would get other individuals on the floor, other females on the floor or whatever to help lift that patient over and things. So just to get them to think about that. Whereas today, yeah, we have the lift equipment and et cetera. As we have increased the profession, you tend to see more men probably in leadership positions. And that's made a significant difference as well, as far as when you look at policies, procedures, things like that may be governing or looking at how we address things. I think, yes, the presence of more men has made a significant difference. And obviously, I'm sure your audience is aware there's been several studies that have shown that as a result of more men coming into the profession, salaries have risen as well, which has really made a significant difference too. And I'm not just saying that men should come into the profession to help raise the salary, but again, I think it's the way I look at that is it's a way we as a society have perhaps objectified women. And it's not until there are more men that we begin to look at equal pay or increasing the salaries. Yes, having more men into the profession, I think, has made a significant difference on so many different levels.
Thinking back about some of our past episodes, we've been exploring kind of the concepts of the interrelation between policy, practice, and education and how those interrelate. Dr. Jerry Mansfield talked a little bit about that and the interrelations between that. And then also had Dr. Amanda Kirkpatrick talk about how joint university appointments can be used, particularly in research, to help those fields interrelate. Where I'm going with this is I'm trying to think about how does your work in anti-racism work in the university setting? How does that bleed over into the practice side? And then also, what does that look like on the practice side that can be pulled back into the university setting? Because you do, in your role, as I understand it, are in both worlds right now. What are your thoughts on that?
Yeah, I think the way that would bleed over is, one, you have the opportunity, or as we discuss various culture, and how, as I mentioned earlier, how cultures may view health and wellness. That translates into, if I'm a staff nurse on the floor and I know that I have someone from either a particular culture or religion, whatever else, how can I work with that person? It's almost like a UPS that has that slogan, "What can Brown do for you today?" So I think if in my nursing education, if I've been educated to talk about culturally competent care and et cetera, one of the things that I would want to do is, upon entering a patient's room and introducing myself and et cetera, is to say, and what can I do to help you today, or to address any concerns or things like that that you may have. And so it opens up that dialogue so that the person is relaxed. I'm relaxed. I know that I hopefully will not be making any cultural faux pas or things of that sort. But it does allow for what you've learned in class or even in research, as that translates that way. And then, of course, translating it back into that is to look at what are some of the metrics that shows that are we making a difference when doing that? Is the patient more compliant? Do they feel more empowered to take part in their healthcare as a result of the fact that you do sit down and say, let's do this together, let's go on this journey together, if you will. So I can see how that translates back and forth there. And also just understanding either word choice that may be used, how in some ways that you may not understand or may not understand that the meaning of one word in one culture could be an insult in another culture. So again, just those understanding or being able to have that dialogue with your team members also is another good way to help address that theory into the clinical setting and back and forth as well.
What advice would you offer nurse executives in supporting men and their growth and development in practicing in the nursing profession? as well as those of diverse backgrounds?
Oh, one of the things that I strongly have advocated for chief nursing officers to do is to develop like a little mini nurse executive academy, if you will. Identify 5 or 6 either men or ethnic minorities within their hospital system, take them under your wings for guidance and let them attend some of the board meetings that are held there.
And
And
are these leaders, or are they already managers, or are
they
these
could
staff
either be
nurses?
nurse managers or they could be individuals that maybe they are thinking about starting on a leadership track. Because one of the things that's, if you find that you're in, or if a person find that a hospital or a system's going to invest in me, then chances are that person's going to stay with that system. And of course, we know about the cost it's going to take to onboard somebody, do the recruiting, onboard somebody new or whatever else. Whereas if you grow your own and let them understand how the system may work and having those conversations, if they were invited to a board meeting, meet with them afterwards and say, when we were discussing this topic, what was your thoughts or your opinions or whatever that may have happened? We're always talking about nurses being at the table or bringing a seat to the table. This is a great way for that nurse who may be at the bedside that sometimes they don't fully understand, as I was pointing out earlier, all the things that may go into a decision that is made that comes down from leadership. So this is a great way for them to understand these are all the components that, that we looked at from a leadership perspective before a policy or whatever may have been sent down. Now, granted, yes, it may be good to ask the end user maybe before that policy is implemented, but and that's a great way to do that. But I think if you're able to consider developing a little miniature leadership academy that you could grow your own. And again, you have people who are committed to the institution, but who are also going to be forward thinkers and be able to feel that, hey, I can speak freely with my chief nursing officer about a situation that they truly do have, I guess, an open door policy, if you will. And that I feel that I can speak with that person freely about things that I'm seeing happening here on the floor that may or may not have trickled up to their level, but it could possibly be a concern later on. So it's a great way to have that back and forth dialogue, and also a great opportunity for that person to feel, if I'm thinking about maybe moving into management or leadership, what better way to do that than to be in the academy training situation, so to speak.
You could describe your nursing journey in one word. What would it be?
I would say challenging. And I love a challenge, a very good challenge. And it's not necessarily that it's a challenge as in bad, but it's challenge as in good because it energizes me to make me want to be the best nurse that I can. And subsequently, by doing that, I'm also being the best individual that I can be as well. Sometimes when I'm giving talks, I will always end it by saying that one of the questions that I ask myself at the end of the day, every day, and have done so for the last 40 some odd years that I've been a nurse, is did I make a difference today? And 99.9% of the time, I can say, yes, I did, no matter what role I may have been in. If it was at the bedside, if it was in leadership and management, or my current position here as a professor at the School of Nursing at Duke, I still feel that I make a difference every day.
You've mentioned on more than one occasion that you're 6'6". You're
Mhm.
from North Carolina. So
Mhm.
this may be somewhat of a loaded question that I'm asking you. We'll see if there's anchoring or confirmation bias in your answer.
You
Who's the
know what I'm going to say. I already know what the question is.
I'm guessing what I'm guessing. Who's the LeBron or MJ? Where are we going here? I'm guessing you're going with MJ then, huh?
Oh, of course.
Why? Why?
Well, there's that UNC connection. I was at UNC for 36 and a half years. And actually, he was there when I was there. Actually, he started as and I had the opportunity to meet him as a student.
Okay.
Very, very impressive young man. But yeah, it would definitely be MJ. There's none like him. LeBron comes close, but yeah, MJ.
Any closing thoughts as we wrap up this episode?
The nursing profession is the greatest profession known to mankind. We definitely need to do whatever we can to get more men and women and ethnic minorities to join this profession and really be the agents of change that we need for health and healthcare not only in the U.S., but also globally as well.
Men in Nursing has been our episode topic. Dr. Ernest Grant, thank you so much for your time today.
Thank you for having me.
You've been listening to the BRG Nurse Executive Podcast, which focuses on improving patient care by advancing nursing leadership. The views and opinions expressed in this podcast are those of the host and podcast guest and do not necessarily reflect the opinions, position, or policy of the guest employer, Berkeley Research Group, or their other respective employees and affiliates.